Hi, I'm Mary Wachowski, and this is my video interview for Leadership and Management.
Okay, Mary, tell us a little about yourself. Briefly describe your professional interests and experiences.
After graduation from Texas A&M in 2016 with a major in allied health, I knew that eventually that I would want to go into a professional career of nursing. However, after graduation, I started my career in retail. I was a salesperson for about 6 months where I handled the day-to-day of customers and um, the sales aspect of that job. I was then promoted after 6 months to assistant manager, where I handled more of the behind the scenes of merchandising and styling. I was here for about 6 months when I knew that this wasn't the correct career option for me, and I knew there was something more out there for me. So, this is when I went to get my certified nursing license assistant license, and I started work as a patient care tech on the mother baby floor of a local hospital in Dallas. It is here that I still am working. I care for the patient on a day to day basis. I work night shift. And I also float around to the different units, so I'm able to see a broad aspect of the whole hospital and the different patients and their needs. So this has really opened my eyes and has really created a firm foundation for my nursing career and and what I will be experienced as a nurse, and as well as helped me through my nursing school.
Okay, where do you see yourself in your career in 2 to 3 years?
In 2 to 3 years, well, after graduation from nursing school, I hope to gain acceptance into the nurse residency program at the hospital that I'm at. I hope to be a labor and delivery nurse. So in 2 to 3 years, I hope to continue down that path and finish my nurse residency program and be a labor and delivery nurse. However, my hospital offers um, where you can cross train on other units, and I would love to be able to broaden my education and my experience on those units to cross train on mother baby so that I can have access to both and help when the nursing ratios or the patient when there are more patients, where I can float to different units to help out the staffing.
Okay. What previous job was the most satisfying and why?
The job I have currently as a patient care tech is by far the most satisfying career that I've had. I know that when I go in at nighttime, that I am going to make a difference in that patient and their family's um, life and just their experience at the hospital. As a patient care tech, sometimes I get the grunt work where I have to do all the cleaning and the messes and setting up rooms and stuff. But I know that at the end of the day, I have helped my patient and done everything I can for their needs, but also in my team, working with the nurses and the other patient care techs and nurse supervisors, I know and anticipate their needs on a daily basis and know that I've done the best that I can, helping them make their patient experience the best for that patient.
You talked about the team there, so tell us a little bit about the value of teamwork and what did you do in your last job to contribute towards teamwork in an environment?
So, as a patient care tech, even though I work on the mother baby unit, I get floated to the other floors when they are short of tech or they just have so many patients. So, I often get floated to the medical surgical floor or the progressive care unit, or sometimes I'm a sitter and a patient with suicide precautions or alcohol withdrawal. I go where I'm needed. And so I often have to learn a lot about the way they operate down on those floors, their dynamics as the nurse and the patient and the tech, and all how they work together. So I'm very well versed in all floors of the hospital and know that when I go down to those floors that they're in great need so that I can work the best of my ability to help them out and um, in the end really help the patient and know that they have the staffing that they need in order to care for them the best way they know how.
Okay. Tell me about the most difficult patient or customer service experience that you have ever had to handle. Perhaps an angry or upset patient, and try and be specific and tell what you did and what the outcome was.
So the most difficult patient situation that I've encountered was actually during my medical surgical clinical rotation here in nursing school. I had a patient and their family, mainly the family member, that was not receptive to having a nursing student and thought that I should not be there. I didn't know anything. And that I was very bad at my job and that I would never be a good nurse. Um, there was a situation where the patient had pulled his IV out, and so she called in a anger, and I was the one that answered the call light. So I ran into the room, and she blamed me for the incident, saying that I didn't know what I was doing and that I pulled the IV out and that we shouldn't have put it in like this. So it really made me have to think about it and have to use my conflict resolution skills that I've learned here in nursing school. Just how to de escalate the patient, to calm her down, to reassure her that I'm doing everything I possibly can. It was actually my first day on a clinical site, so I really had to put my fears and use my confidence skills in order to talk her down and to reassure her that we're here to help. After I put a band-aid and there was no bleeding from the IV site, hung the IV back on its pole because I was not qualified to care for the IV site in any way. I explained to the patient and his wife that I was going to get my nurse preceptor and that she could talk to him in any way possible. And she came in, explained the situation, that I was a nursing student, that we're doing everything we can, and I'm just following around. By the end of the shift, however, the patient's wife, as well as the patient, they apologized for their actions. And so I believe through my skills of conflict resolution and the confidence I had in that situation, I was really able to care for the patient in the way they needed, as well as care and use my communication skills to help the family member throughout that time.
Okay, thank you, Mary.
Thank you.